Continue. All right, so
Hold.
oh,
Now you're set.
okay. James, do you want to do a roll call?
I don't have the list, but
I don't either. I can.
here, well, I'll just read down the listing of the participants here and they can each indicate they're here.
Okay, thank you.
All right, so Megan Mankey,
Here.
Dana Landy,
Here.
Robert Hillman,
Here.
Paul Boutot,
Here.
Jeff Barron,
Here.
Keith Chapman,
Present.
Stephen Clark,
Here.
Carol LeBrecq.
She's here.
He's here. I know she's here.
Here, sorry.
Okay. Now my things are all going on order on me here. Ethel Kramer. I see her there. Janet Murphy.
Here.
Jonathan Butler.
Here.
Michael Morgan.
Here.
And did I miss anyone?
Charlie Brown. Yo.
Riley Brown, I thought I did. I saw you bounce around on there. All right. I believe that is everyone at the moment.
Thank you very much.
You're welcome.
All right, so we haven't met in a bit. I haven't been to a meeting since the October meeting. The January meeting, we had an emergency that I had to run out on, and the deputy emergency management director ran the meeting, and then we canceled April. So we haven't met in a while, so I'm sure there's a ton of updates on all of these things. And could we just I need a motion to approve the minutes from the January meeting.
Motion to approve.
Thank you. Is there a second?
Second.
Right. I did not get any amendments to the minutes that anyone noticed. I didn't write these. But I wasn't there, so I can't make amendments to the minutes. If it's all good, I did not get any correspondence other than Ryan saying that he couldn't be here. Any public participation?
No one's on with us.
All right, that's easy. Unfinished business. I did invite Janet and Paul into this meeting just because a lot of these things that have been on our agenda for quite some time have a lot to do with either their departments or grant funding that could possibly resolve some of these bigger projects that we've been working on for a while. But we'll start with the radio system updates. Paul, did you want to talk about that?
Sure. So as at our current position right now is that we are negotiating pricing with subscriber counts, dispatch consoles for public safety on the CLMRN, which is the Connecticut Land Mobile Radio Network. The fire department, EMS, and police department all tested out radios provided by the state, utilizing tower infrastructure from Britain as well as Troop H. All reporting parties said that they thought the test went extremely well, better than the first test that we did with just Troop H towers by themselves, as far as the radio frequency. So that was good. So now we are in the process of obtaining pricing on what it would cost the town to get public safety subscriber units onto that particular network. One advantage of that is that we would not require any RF towers in our town, so that would keep our costs down significantly. Radio towers are approximately $1 million to $1.4 million a piece in order to erect a new tower from scratch or to retrofit a tower with all the equipment that the state and Motorola would require us to have. So that's where we stand there. So prior to that, the radio committee, as far as the public safety, met, established some things that they were looking for, hired an outside consultant that was brought on, made a recommendation that we should entertain and consider the Connecticut Land Mobile Radio Network as one of our options. And that particular price point that was provided included bringing towers into the town. But since that report came out and was submitted to town council and the manager, we found out that New Britain was willing to allow us to test their towers, which are on the state system, and that proved beneficial to us and hopefully reduce our cost. The other alternatives that we had reviewed was to stay with our current vendor that we have now. They submitted some pricing on that, and that would have been maintaining our existing frequency range that we have. We're still shy frequencies if we were to do that, but that would be an all-inclusive system to include Board of Education and public safety. But from the public safety's point of view, it was not a true P25 capable system, even when proposed as an alternative to the state. So right now we do have pricing for that. One of the things that still needs to be ironed out will be where the Board of Ed ends up, as far as radio services, right? So we either have to keep them on the existing infrastructure, or one of the things proposed by our current vendor was to put them on a DMR system, which is a digital radio system with local hosting at each one of the schools, interconnected through their communications network, and subscribe either to Marcus's statewide communications antenna infrastructure if needed, or just have local tower here that would accommodate local radio traffic. Our public works, our government services, those would still be on they qualify to be on the CLMRN. The Board of Education's count as far as all their buses, all of their personnel and the radios that they have is something that the state is not entertaining as far as bringing on to the state's public safety radio network at this time. So that's why we're looking at alternatives for the Board of Education. And that's pretty much where we stand right now. Once that pricing comes in and we're able to negotiate our position, also finalize subscriber counts, that's portables, mobiles, as well as the accessories that go with a public safety radio system, then we'll be ready to submit a report to the town manager's office for consideration to forward to council, and then make a decision on where we're going to end up.
Perfect.
If I may, prior to a submission to me, there will be another meeting of the public safety chiefs, correct?
Correct. Yeah. In order to finalize all the subscriber counts, accessories, each one of those departments, just like they submitted a report to us on their testing of the system, we'll also make sure that we get sign off that we did capture all of the subscriber counts, accessories, the items that they need, extra batteries, things of that nature. And then that'll help us get the final price quote from Motorola and the state.
Great. Thank you.
And Paul, you the emergency management radios, those are going to be a separate cache of radios that we have, right?
Well, that would be one of the counts that we have to factor in on the system, right? So even with the Board of Ed, even if they were to go on a DMR, I mean, one of the things that we would look at is, can we take the DMR system and then actually patch it into the public safety console? So then that way dispatch still has the ability to talk onto that frequency if needed, and vice versa. And then from the CERT radios or emergency management radios, we just got to determine what side of the fence they're going to be on. But again, those counts I think are insignificant, so it's not going to be a big differentiator. But I would definitely need to know from you what your subscriber counts would need to be. So that would be portables and or mobile radios.
Okay, yeah, we can talk about that. I just wanted to see. I know I think we submitted a memo just saying that we needed to be part of that project, just because the dynamic of emergency management has changed so much. It'd just be a good idea to have our own supply. All right. Does anyone have anything else on that project? Paul covered it pretty thoroughly.
Yeah, I do, Megan. Just since the Board of Ed has been left out of this pretty much thus far, I would request that we get something in writing sent to me and to Dr. Brummett as to where we're at now and what the two different options that you just explained for our potential future, what those are and what the specifics are, because there seems to be still a little bit up in the air as to where we stand. And like I said, we haven't been involved in any of the meetings or discussions. So it's important for planning purposes for us to know where we may end up in the very near future so we can plan on our end.
The first round in this, Michael, is to deal with the public safety, the 3 public safety entities. It is clear, based upon discussions with the state, that the school Board of Education radio systems will not be on the state system. So we're holding that back until we finalize the public safety, and then we'll be looking to Marcus to propose exactly what we're going to do with the Board of Education.
Right, I completely understand that, but I believe Paul just said it was an either or. We were looking at this
No.
option or that option. There were 2
No,
different
there is-
options that the school could end up on.
I don't believe that's going to be the case. Do you, Paul?
Well, again, when I say the either or, Mike, was the discussion was, do you maintain the existing infrastructure, but it needs an upgrade, right? It's a lot of components are end of life, or they can still be kicked down the road. But from a public safety point of view, it's not something that qualifies as a P25 system. So from Board of Ed, normal, traditional, commercial use or whatnot, it may be satisfactory for that type of an environment. So that would be, when I say option, that would either be, okay, how much does it cost to maintain that or keep it going forward, right? You'd also have to see if whether or not the frequencies that are out there that we're utilizing right now, can they be used for your needs, or do they automatically go into a pool because they may be considered public safety frequencies? So that RF spectrum will be something that would have to be investigated. The other option would be to look at what a lot of Board of Educations are doing, which is a DMR type solution, which is a digital radio system. So at the schools, you can talk to yourselves within the schools, as far as what Marcus was explaining to us. And then that the schools through your data network could be interconnected. So then if, a custodian from Wallace needed to talk to someone at the high school, it would go ahead and go from the local system through the data network, talk to the custodian at the other facility. And then you still would have an antenna. Currently we're on Callahan Mountain, or not Callahan Mountain, but over off of Callahan's property, which is on Cedar Mountain. And at that point, still have a distribution antenna there to assist with coverage within the town itself. So that's what Marcus brought up to us. But yes, would that need to be discussed further as far as options, or to see what options are available? I guess that and or remaining on the existing system, that would need to be discussed.
Yeah, I think that'd be great if someone could just send us an update on that information right there. We haven't received anything on what you just explained.
Paul, is that something that you would put together?
I could, again, Keith, if you don't have any objections, I can provide that.
I think it's premature. Our plan at the beginning, and we want to stay with it, is that public safety gets addressed first. Once we're done with that, then we'll look at any other requirements for other agencies. But I really want to get the public works done. I've given you till July 1st to be prepared to present to the council. That's my goal. Then we'll look at the other agencies and their needs.
So I guess I'll tell Dr. Brummett after July 1st, she can expect something more.
Yeah, that's what our plan has been. And that's why you guys haven't been involved, because it's strictly the public safety entities right now.
Okay, thank you.
All right, so we will move on to the August 4th storm, which I can't believe that we're still talking about. We did have to put together, we had the preliminary damage assessment that was due late September, early October, which we did a ton of work on. And then Janet and I have been working with Fema for the actual reimbursement. And Janet, what was our final total that we put in for? We did submit it. It was like last week or the week before.
Yeah, it was in the $300,000 range.
And I mean, I don't know what the expected turnaround time of that, but I appreciate everyone who resubmitted paperwork for this. It was a ton of work the first time around, and then we had to basically submit everything again in a different format for the actual project. So thank you for everyone who's helped out with that, especially Janet. She did a ton of work actually getting it into the system. But Janet, was there a timeline on when we were going to see that?
Right now, they're just reviewing the project, and once it gets final approval, they'll send us something, but we'll probably have follow-up questions. So it's kind of just going through its first step, and then I'll go to another group at FEMA, and he didn't give
Right.
us kind of time period. I wouldn't expect this anytime very soon, to be honest.
Yeah, and we'll probably have to resubmit everything again. So
Yep.
I'll keep better track of where those things are.
I got a folder of it.
Yeah, me too. I got multiple. So that's where that sits. Hopefully the bulk of the work is done on that. I'm gonna skip C and D for a minute, just because E and F aren't related to like what we were gonna talk about. It's just grouped wrong. So I'm gonna skip to E, if that's okay. Sorry, James. This one's pretty easy. Ryan was gonna do this update. We have a draft of the town hall emergency action plan. It's been a draft since probably October, and then COVID picked up again. And this, and I'll say the same thing for F, our emergency operations plan. Both those projects, Ryan and I dove headfirst into to get those written and or updated. And then everything hit the fan with COVID. So we are, now that things are finally dying down again, unfortunately, the fire marshal's office has been a little crazy. So it all is just coming in waves, but I did talk to Ryan earlier in the week. We still have that draft of the town hall plan. I did start to work on it over the weekend. And I'm hoping to have that at least by the fall, like our October meeting is the goal, to have that completely done and actually start doing the training. We're going to do an active shooter training with everyone who works in town hall. We are going to do a couple fire drills. We're still trying to get the alarm system figured out. But we're ready to move on it, especially now that the urgency of like the building's open to the public. I really, want to get that pinned down so everyone knows what the protocol is, what they should do if anything should happen. And then the emergency operations plan, again, I actually am working with a couple of our other emergency management directors in the area to see how they kind of streamlined the process of updating that gigantic document. So it's actually a good thing that we tabled it for a little bit to deal with COVID, because it gave us the opportunity to just inadvertently work with other emergency management directors who have actually streamlined the process, that like it's not going to be as involved a process as we initially were going to take on. So that is also in the works. Again, I worked on it this past weekend. So I'm just going to keep plucking away at it while I have time. And again, we're hoping to have that done before the October meeting as well. And I just had moved a couple of things on the agenda because the Emergency Operations Center location, the emergency management supplies, and the generator for John Wallace, I think they all are going to be talked about in probably the same conversation. So does anyone have any questions on the action plan or the EOP before I move on to those?
Question, Paul, we talked here. Will that plan be shown, I guess, to anyone while it's still in draft for comment or?
Yeah. So it's going to be, we just have to get the format down. But we had started moving it to this whole crazy new format, and we found out we don't actually have to do that. So we're just going to take the existing plan and send it out the way we used to. And we're going to reformat it based on the feedback we get from there, which was the complete opposite of how we were going to do it. So yeah, it's going to go out to the relevant departments for feedback and input and changes. Obviously, it's going to have a lot of changes. We haven't changed it or updated it in a few years. And the whole dynamic of our town has kind of shifted. We don't have the same town hall buildings. We have like a bunch of different department heads. We have a different town manager. So there's a lot of things that would have to get updated regardless, but that will definitely go out as we move along in this process. I have to get through probably the next few weeks are hectic, and probably after the extravaganza is when things are going to start slowing down, where I can really dive like headfirst into this. But but I will definitely get those sections out to the relevant department heads. Anything else? All right. So we have, I'm gonna defer to Janet and Keith and anyone who has input on this, but we have a significant amount of grant funding that's coming into the state and relief funding that's coming in to the town. And it's very specific. Janet, what are the 4 categories that we can use the AR money on?
Right now, the first one is to respond to public health emergency with respect to COVID-19 or its negative economic impacts. To respond to workers performing essential work during the COVID-19 public health emergency. For the provision of the government service to the extent of reduction in revenue. And the last one is to make necessary investments in water, sewer, or broadband infrastructure. So they're vague but specific. They really wanted to relate to COVID in any way we can when we tie this back to it. And
So,
I've got feelers out to the Treasury and stuff regarding some of the uses. But if we can prove we have a reduction in revenue, which I just got the formula yesterday to do the calculation, that money that we give back, we can use however we want to use. But I
Okay.
just have to see, they base it on a certain amount of growth that they expect every town to have. And I've got to just sit down and use the calculator that they have to see where we are in that aspect also.
right. So there's a few things that have been on our agenda for years, at least years, which is we need a location for the EOC. We would like to also, in that same token, want to properly equip our backup EOC, which has there's been talks of it being the PD training facility on Milk Lane. The storage that right now, the emergency management supplies, for anyone who doesn't know, they're stored at Chapman Street and they are getting destroyed. Once a year, our CERT team goes and they clean them all because there's no temperature control in that building. It's extremely humid, especially I can't imagine what they're moldy. They're getting destroyed there, and that's not ideal because if we had to open a shelter right now, you don't want to have to clean and disinfect and hose off cots before people can use them. So we've been talking about that for a while. And we've also been talking about having John Wallace equipped with a generator, which not only as a backup shelter location, but it's our only town building with a loading dock, which FEMA will have to, if they were going to give us supplies, they would have to, it's like one of their things. They have to deliver them to a town building with a loading dock. And right now that's our only one, but it's not equipped with a generator. So even using it through like the funds that Janet was just talking about as saying, you know, if we had to open a shelter in this town during the world of COVID and we had to socially distance, that would just, I mean, we would cut our shelter numbers, which aren't significantly high anyways. We would cut them by even more. So we would have to open alternate locations in order to both adequately, house people for any length of time, but also keep people separate enough, which brings up like a staffing issue and things like that. We do have the CERT team, and we could make it work, but not without another location that was equipped to actually set up a shelter in. So there is the possibility of trying to, kind of finagle things into the 4 categories that Janet just mentioned. We did separately last week in a pretty quick turnaround, apply for a grant for an emergency operations center through FEMA. Well, it was to Senator Murphy's office, it was to the state, and then it's going to go forward, hopefully. And so there's a good amount of opportunities right now out there for emergency management. So we're going to try to resolve some of these issues that we've been kicking around for a while. Now that we have the opportunity to do that. So if anyone does have any other input or ideas on things or things that we talked about years ago, I'm going to go through our old agendas and see if there was anything that just slipped through the cracks that we never resolved, but really should. But if anyone has any input, either now or if you want to email it, we can try to figure out how to get that covered. Like I said, we're getting the money, and now's the time to bulk up those flaws, I guess. We did identify a significant amount of flaws during this whole COVID thing. And we want to, I don't know that we'll do an after action because it's not even over. But there are a lot of things that we've identified as weaknesses in our emergency management system in the town through this, including during the snowstorms. Like, are we opening a shelter and how are we going to do that during a pandemic? And I guess that was never anything that crossed my mind, but now it certainly is. So we want to prepare for that and do whatever we can. So if anyone has any other ideas, like I said, just shoot them in an email if we want to open it for discussion here. I don't know, Keith, do you have anything that you want to add?
Well, it is one of the goals that I have to finalize a location that's going to be adequate for all of the needs for the Emergency Operations Center, whether it's a current existing building that we own or whether it's something that we acquire or something that we obtain some other way. We'll see as we go forward. A lot will depend on the amount of grant money that we are allocated. We put in for what, $1 million?
For yeah, so that grant is specific to, so we initially put in the renovation 250,000 and then we switched it to $1 million for a new build.
If we're fortunate to get that, then that will help make a decision on where we're going to go with it and how
Right.
we'll get there. So I think we're still too premature to know any definites at this point until we know what kind of funding we're going to have, and then we're going to go back into this and decide what we're going to do and where we're going to do it.
Right. And ideally, just in terms of the agenda items, ideally our EOC location would have a separate store, like we could put our shelter supplies there as well. So
Yep,
that's
the
in a
goal.
perfect scenario. Right now, everything's kind of spread out
No.
at different towns. I got COVID supplies in the conference room here. I got COVID supplies at the senior center. I got shelter supplies at Chapman Street. So trying to like kind of just get all those things in one place will make it so that we can actually move and implement our emergency operations plan should, if and when we need to do that.
Well, as I said, this is a goal that we want to accomplish this year. It's been kicked down the road long enough, and it's time to bring it to a head. So that's where we're going to go.
Does anyone else have anything on any of those?
Improvement of distribution sites, just for future, because distributing vaccine and vaccinating people needs a little more space dedicated than we've been able to in the past. So I know that's obviously a space issue, but just kicking it out there. If anything does come up that could be attached or near EOC or anything, but I'm sure Megan will talk more.
Yeah, I know. So I don't know. Oh, you know what I never did on the agenda? James, do I have to make a vote or something on this? For H, the next one, COVID-19, we were also going to put CCHD updates. CCHD updates is always on our agenda and just didn't, I must have deleted it by accident. But we can talk
right under that same topic.
Okay, all right. Because I was just going to ask, that's a good segue into our plans for the, if no one else, does anyone else have anything on the EOC or any of those grant issues?
Just a quick question on the EOC. So on the grant that we've applied for or made a modification on, what is the criteria for that? Or do you know that yet, or is that still being established?
The criteria is, I mean, the only thing we know right now is that we put in we switched it from a renovation project to a new build project. Because it was a 250,000 versus $1 million. And we found out that we only had, I think the final number of applicants for that grant was 6, and there was $14 million. So that's why we initially switched it. But that's right now all we know. And we're just kind of in limbo waiting on whether or not we're going to move to the next step. But I will say that the other towns I know of that put in for it, just in talking to other EMDs, they're talking renovations. I think we're actually the only town that put in for the full $1 million, just because they've spec'd out projects and they want new floors and they want, renovation type issues. Whereas we don't have one. So I think ours is going to be high up on the priority list. But again, I don't have any other information on it other than waiting for them to move it to the next step.
Thank you.
All right, so Jonathan, I don't know if you want to talk about, just because you brought up the distribution sites, if you want to talk about the flu clinics and the plan for that.
Sure. Yeah. So this year we're starting to plan for the flu clinics. We're working out dates right now and then trying to figure out how we can make it equitable between every town. Because, you know, we don't want one town just getting jammed up at the end of October. And just that's generally how we flowed. I've talked with Megan, and possibly the Cedar Crest Hospital is going to take a little bit of coordination with the state and some other people to try to make sure it's usable for us to have a site. But I have at least a quick plan hammered out, and it can be done because that site's large enough. That coupled with the scheduling system Lewis put together should help the district keep the flow to not be what it was last year. Obviously, Newington, we had no issues. It was over at the school, so we had plenty of places to push stuff to the north. Just using that lot would probably not be preferential this year, just because of the condition of the lot and
Yeah,
the
it was
age
all
of our
dirt, right?
nurses. It's all just the chunky gravel stuff, but just cleanliness, dealing with 18-wheelers that parked there, you know, the night before. So it's all fine and got worked out. It's just there can be catastrophic failures there where if there's a dedicated site or somewhere a little more remote, it just doesn't happen as quickly. There'll be Churchill Park as well that we're going to look at. It's a lot smaller. So maybe if we have some satellite, smaller location, that's an option. But the other thing we're just keeping in our minds is if COVID opens up for younger people with what vaccine were allotted or available at the time, there's going to be other things that hop in there. So we really want to be flexible to be able to possibly have our regular clinics at the senior centers as we've done before, drive-through clinics, and then kind of keep a head on a swivel for one more of those. Who knows what kind of clinic it will end up being. But that's kind of my plan right now. So, you know, we're just prepared. October will be a big month for us as far as flu. We're just hoping that there's good enough uptake, because if there's not, we just don't want to have a dual pandemic, or just even people that have had long COVID get infected with flu and then succumb to the flu. So there's just other things that may compound problems this year. But as far as the flu clinics, those are our options in Newington to start, and we'll expand from there.
Jonathan, is there any more information on booster shots and if that's going to be a necessity in the fall as well?
So as of right now, boosters are not a necessity and they are not on the horizon. The only thing I know is Moderna has been putting a ton of things into production. So they're testing a lot, but we're seeing that there's good enough coverage, even for some of these Delta variants and some of the newer stuff coming through, that the vaccine is still proving to be effective enough to where another booster is not going to do that much at this point. So what we're kind of planning on is a normal flu clinic season, and then don't really look at it as a booster, because there may be other shots. You know, we look at a flu shot, it's not a booster every year. There are different formulations targeting different strains from different places. So hopefully it doesn't get to be a yearly thing. Maybe it's just every few years there's a variant that's actually, you know, got some escape potential. But that'll come out in the wash in the long run. But as of right now, with us still doing first shots, I don't see them being able to spin up a system to even deliver, you know, second shots without messing a lot of things up right now. So I would say probably a normal flu season, and then any booster hopefully would be this time next year, so that we can kind of get on a schedule of every other year or every 3 years, trying to get these done in the summer, so that we don't have to, you know, jam it into all the vaccinations kids have before going to school, while they're in school. You know, you guys know the gamut of all that other stuff.
All right, Charlie, do you have anything to add? Or Jonathan, do you have any other updates from CCHD?
Vaccination rates are still super high. Sorry to cut you off there, Charlie, but the state's doing well. The only confusions coming in is sometimes when you're looking at the numbers reported by DPH, you're getting a number that is lower than what the governor's reporting. That's because federal centers that don't report to the state are in his report. So we don't get the granular data that the state wants to be able to pick out certain data points. But the reason the governor is getting more is because the VA doesn't necessarily report all vaccinations to the state, and neither does all the federally, the pharmacies doing it through the federal pharmacy program. So there's just some stuff falling through the cracks, but comparatively, even look at our numbers without those, we're still very high compared to a lot of other states.
Yeah, I mean, the only thing I would add is that, you know, even with our rates being really high, you know, we're still looking at the variants that are coming in, places around the country that have low vaccination rates, and the possibility of, you know, of that causing issues down the line. We're not at the end of this yet. I think we're in a good position, but it's still something to be aware of and know that, you know, I think if we get to the end of the year, then as Jonathan was saying, I think we're getting into the management phase of this and less of that crisis response.
Hopefully.
I'm keeping my fingers crossed, y'all.
Yeah, so that is the gamble, that we went heavily on vaccination. As you guys see, the non-pharmaceutical interventions, people aren't going to follow them even if you wanted to keep them in right now. But it is a gamble right now. It's supposed to be vaccinate, keep the MPIs, and then come back in. But it just doesn't seem feasible at this time. So, you know, it is a gamble, but hopefully it works. And the good thing is we vaccinated fast enough that if an emergent variant comes from somewhere else, hopefully Moderna and Pfizer will already be spun up, because they're sequencing a lot and trying to, you know, their business. They're not going to let a good crisis go to waste. So if something does come up that they can profit off of, you know, it is what it is, but they're definitely going to be on it to try to make something.
Right. I guess, I mean, we haven't met since January, and it's been a lot that's happened in between. But the only updates that I have is that we got through the vaccination clinics. The CERT team was amazing. Our volunteers, Cchd, the senior center, human services. I mean, it was a lot of work and a lot of hours, but we got through it, and hopefully we never have to do that again. But we're a lot more prepared now than we were in the beginning of it to do it if we need to. And let's see.
I would add on to that, Megan, CERT helped us a lot. Them helping with flu clinics made us able to hit the people that we did. We could have done other flu clinics that would service us on this call and normal people that can go through everyday life easily, but access and functional needs was our key demographic. So with the health and human services, the senior centers and everything else, I feel like CERT was that linchpin that if they had not been so squared away with everything else, we wouldn't have been able to shift to that, and we would have had to do less vulnerable populations, which is kind of our bag, to do vulnerable populations. Right. I just can't thank you guys enough for the CERT help, and then Carol and everybody else that's helped on every end of this, whether it was the Senior Disabled Center or Human Services.
And I, on that note too, I did meet with the 2 of our 3 other towns in the health district, their EMDs who are, the EMDs have been trying to say we should get a CERT team for a while, I think, but the administrators of their towns finally saw the benefit of it, just having our CERT team. You know, our volunteers were supporting all 4 towns, and they really saw the benefit. You know, they wouldn't have happened without it. So without those people there. So I did have a meeting with them last week to discuss, you know, how they can either we can regionalize and we can have them join our team, their volunteers, or, you know, actually establishing their own teams. So that's something, again, it's like one of the benefits of COVID, that silver lining of the good that comes out of it. We got a lot of grant money to kind of finally resolve, hopefully, some of these issues. And, you know, these other towns are actually seeing the worth and the benefits of the CERT team. And, you know, there's a lot of other things that we could talk about that are good. But I did want to just mention, too, that the other towns really, hopefully, are going to be equipped with their own teams here soon. Does anyone else have any? Oh, the reopening. So I'm sure you all have gotten the emails and the updates. So the town hall We phased in a reopening and we're currently in the gray. So there are some towns, I know all the school buildings are still requiring masks. There are some buildings, if you're vaccinated, you do not have to be masked, town hall being one of them. It depends on what town building you go into. If it's posted that you have to wear a mask, you should wear a mask. But while we're in the gray, vaccinated individuals do not have to wear masks, at least in town hall. And the outdoor events, which I've got food truck inspections that I have to be at in a few minutes here. The outdoor events, hopefully people are smart and they don't come if they have COVID or if they're sick. And because I know people will not be masked at these. So hopefully we don't see any uptick in our numbers. But the next couple of days, we have 3 events in town, which I guess is a great segue into what we have for the new business, which is the upcoming event, EAPs. So this week we have 4 large events, 3 Parks and Rec events, and 1 Chamber of Commerce event. Tonight is the car show in Market Square. Market Square is closed to parking 15 minutes ago and is closing for the evening at 3 o'clock. And they're going to have 1 lane open for emergency access up until Steve's Place, just beyond Steve's Place, where the cutoff into the parking lot is. Beyond that will be completely full of cars. There's not a lot for that event. We have to do anything emergency wise, other than I coordinated the access, and I'm going to go just make sure that is coned off appropriately. Then we have, St. Patrick's Day tonight in the park. And then tomorrow is Food Truck Friday in the park and Motorcycle Madness on Saturday. So we do have a formal EAP for Motorcycle Madness. We dumbed it down a lot. One of the things that I noticed when I went to look at the EAP for both Motorcycle Madness from the last time we did it, which was now 2019, and the extravaganza, where the dynamic emergency management has completely changed. Just because Chris Schroeder used to wear 3 hats: fire marshal, fire chief, and emergency management director, and now there are 3 different people wearing those 3 different hats in 3 different departments. And the deputy emergency management director is now in the police department. So the dynamic has completely changed, and where we wrote a lot of our EAPs to kind of accommodate the fact that both Chris and I would have to change between those 3 hats at any given moment. We got to shift it and figure out how to do the same thing with, both Sergeant Dean and I wearing at least 2 different hats. So they're not the same EAPs, and it's actually a little less complicated. For Motorcycle Madness especially, we used to, set up, monitor the frequencies, monitor the radios that everyone was using. And we're still going to do that, just on a more, I guess, relaxed level. There really isn't a need for where, like, we used to have the command post and sit in it and monitor from there, because we also have to do, on Saturday, I'm going to try to monitor the radio frequencies while I'm doing food truck inspections, because there's other things that I have to do on Saturday for the fire marshal's office. But it's not a requirement, I guess, that we be in the park for the extravaganza. It's just a totally different setup, is what I'm trying to say. And the extravaganza is going to be a lot more involved, just because of the context of the day. But I don't anticipate any problems on Saturday, this coming Saturday. The weather is supposed to be, the heat is supposed to break, the humidity is supposed to break. EMS isn't going to be in the park, correct, Chief Megan? You're muted.
That is correct. We won't be, there might be a crew available tomorrow for the food stuff, but not for Saturday.
Okay.
Not to throw a monkey wrench into it, but we got information that the Pagans may be in town, motorcycle gang.
Yeah.
They're going to be at the Lifeway Church for a funeral. So there's a good possibility that you may see a group of them come down to the Motorcycle Madness scene if we're going to be in town.
So I did hear that, but I don't really understand what that means.
What do you mean you don't understand what that means?
Like, I don't know what that group, like, I'm not familiar with it.
They're an outlaw. They're like the Hells Angels. They're
Okay.
an outlaw motorcycle gang.
Okay.
It's something that we're going to have to be aware of. We were unable to staff it, so there's going to be 4 Berlin officers over there working, and we'll assign them one of the inside sergeants. So it's something that we're going to have to keep a very close eye on, just knowing that they're going to be in town, and there's a chance they're going to show up. So
Okay.
just be aware of that.
Yeah, they don't really get along with Hell's Angels that well, so that's why they're probably.
Yeah, they don't get along with each other very well.
Okay. So I guess we'll prepare for that. I'll write that into the plan. I don't know that, I'm still trying to figure out if, right now it's just, I'm sure all of you know this, but right now it's only myself and Craig Stegmeyer in my office. So we're just trying to figure out who's going to do what and who's available at what times this weekend. He's got 7 children who have different sporting events and things like that. So, 7 children, and that's enough said, I guess. So we're just trying to figure out the availability and what each of us can do. And I'm trying to figure out the availability of if our deputy EMD can assist at all, and how that all works. Again, it's just a different dynamic, but we will get through it no matter what. And I think this is going to be kind of a good precursor for the extravaganza. It's just different that we're even having events. So I'm still trying to get used to that idea too. That being said, the extravaganza EAP, a lot of what happens and what goes well and doesn't go well this weekend, just because of that different dynamic, is going to influence our extravaganza EAP heavily. So we'll see how it works. I don't know if anyone else has any input on any of those events that are coming up. I think the extravaganza and Motorcycle Madness are the biggest ones that we have at formal EAPs for. We dodged the Memorial Day one. And I think that's it. No, that's irrelevant to this. We do have another CERT event coming up, but it's not in this town. Does anyone else have anything to add, even if it's unrelated to these events? I don't see Keith on here anymore, but I don't know if he had anything new to add. All right, we can move on to public participation.
Nobody with us.
All right, and can I have a motion to adjourn? Charlie, I saw your hand.
I'll make a motion.
Second.
All right. Thank you, everyone. Chief Clark, could you just give me a call about that after
Sure.
this?
Yep.
Okay, thank you.
You bet.
All right, thanks, everyone.
Are you at your desk?
Yeah.
All right.
All right, bye, everyone. Take care.